oral semaglutide and cardiovascular outcome in patients with type 2 diabetes. Okay, so the definition, diabetes mellitus is a disease that occurs when the pancreas cannot make enough insulin or when it fails to act in the body because the cells do not respond its stimulus.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Application in medicine. This medication increases blood sugar control by mimicking the action of a hormone called glucagon, like peptide type 1, GLP-1. Among other things, these drugs stimulate insulin secretion in response to elevated blood sugar level after a meal, leading to...
We first started looking at semaglutide early on. We knew that it's a more robust molecule just from a A1C lowering, but also from a weight perspective. And when I started talking about oral semaglutide, I think the goal was that we could reproduce liraglutide in a pill. And this trial actually showed we in fact did better than that. So going against our once daily leader Victoza, we were looking to see if we could have a similar, if not maybe a little better A1C effect, and then certainly hoping and expecting we would see a little bit more robust weight reduction, and we did see that, as you mentioned. So it's encouraging that patients can now have an oral option for a GLP-1 therapy instead of having to go to injection. And we hope that that really does open up treatment for many patients who could benefit from GLP-1 that aren't getting it now.
Pros. Helping control blood sugar and lose weight, this class of medication can also improve her health. Research suggests that some drugs in this class of drugs appear to reduce the risk of death.
Hey, what's going on, guys? This is Tyler, pharmacist with Pharmacy Update. In today's video, we are going to discuss the drug Ozempic, or semaglutide, which is used to treat type 2 diabetes. It's a fairly new drug. It's been out for around 1 to 2 years now. I have seen an increase in the number of prescriptions for Ozempic here recently. Does seem to be getting more popular with doctors, at least in my area. But today I will be giving some information on this drug, including just a general overview of Ozempic, the warnings and contraindications, including a black box warning, side effects you may experience if you use Ozempic, and then at the end of the video I will be discussing this drug and weight loss. This seems to be a question that I get a lot about Ozempic, if you can lose some weight or not, so I will be covering that today. So here we go. First here I want to cover some general information on Ozempic. Like I said, it is used to treat type 2 diabetes. Along with diet and exercise, it can be used to lower blood sugar. And one nice thing about Ozempic is that you only have to give yourself one dose per week. So you will be giving yourself less injections than some other products, such as Victoza. Victoza is a once daily injection. The drug class for Ozempic is known as the GLP-1 receptor agonists. So this drug mimics a hormone that is produced naturally in your body, GLP-1. And what GLP-1 does is it stimulates your pancreas to make more insulin, but it is dependent upon how much glucose is in your bloodstream.
A statistic: in Ecuador, diabetes is affecting the population with increased rate according to ENSOT survey. The prevalence of diabetes in the population age 10 to 59 is 1.7%. That portion goes up from the age 30 and 51 in Ecuador. Conclusion: in this case, involving patients with type 2 diabetes, the cardiovascular risk profile of oral semaglutide was not inferior of that placebo. Cardiovascular disease is the primary cause of death in patients with type 2 diabetes. All currently approved GLP-1 receptor agonists are administered subcutaneously.
Part of its regulatory process, the U.S. Food and Drug Administration requires drug manufacturers to assess the cardiovascular risk of all new therapies for type 2 diabetes. Semaglutide, a glucagon-like peptide 1 or GLP-1 analog, with a half-life of about 1 week, lowers blood glucose. In a multi-center, double-blind, non-inferiority trial conducted in 20 countries, investigators randomized 3,297 patients with type 2 diabetes who were receiving standard care either to once-weekly semaglutide injections of 0.5 milligrams or 1 milligram, or to placebo. The patients had a mean age of 65 years and had had diabetes for an average of 13.9 years, with a mean glycated hemoglobin level of 8.7%. 60% of the patients had a history of ischemic heart disease, and 93% had a history of hypertension. At 104 weeks, the primary composite outcome of cardiovascular death and first incidence of non-fatal myocardial infarction or stroke had occurred in 6.6% of the patients who received semaglutide, as compared with 8.9% of those who received placebo, thus confirming the non-inferiority hypothesis. Overall, adverse events were similar, but more patients receiving semaglutide had gastrointestinal symptoms, and more discontinued the study drug because of adverse events. Thus, semaglutide, when added to standard care for patients with type 2 diabetes, was not associated with excessive cardiovascular risk.